Hi everyone, it's Jason here, and today we're going to be talking about bipolar disorder. Alright, so here's a little bit of an overview. Formerly called manic depressive illness or manic depression, bipolar disorder is a mental disorder that causes unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day-to-day tasks because of the mental and physical fatigue that it causes on the individuals with this disorder. Alright, so how many types are there? There are currently three different types of bipolar disorder that have been based upon the up and down mood changes and are categorized by severity each type causes. So the one I have on this slide is bipolar 1 disorder, which is the more severe one. It's manic episodes, meaning that an individual can be very excitable and irritable during this period that may last up to 7 days, or manic symptoms that may cause immediate hospital care for the individual. Depressive episodes may occur as well, lasting as long as 2 weeks, and there may also be a mixture of manic and depressive episodes occurring at the same time, meaning that the mood of the individual can change very rapidly throughout the day, changing from feeling helpless to very irritable within an instant. Alright, so now we come to bipolar 2 disorder. Considered to be a pattern of depressive episodes and hypomanic episodes, but are not full-blown manic episodes that are more common with bipolar 1 disorder. Symptom lengths tend to be shorter on most occasions, usually only lasting a few days, but may need medical treatment based on the severity. All right, and the last one's gonna be the cyclothymic disorder, also known as cyclothymia. It is defined by periods of hypomanic and depressive episodes that last as long as 2 years, a year usually in children and adolescents. However, most of the symptoms do not meet the requirements for either the hypomanic or the depressive episodes, since the symptoms are less severe compared to bipolar 1 and 2 disorders. Alright, so now we're going to talk about signs and symptoms. There are distinct periods known as mood episodes that often show different behaviors that are not typical for the average person. Usually these symptoms last for most of the day, and these periods may last several days or even weeks depending on the severity. People having a manic episode may show signs of have decreased need for sleep, loss of appetite, talk very fast about a lot of different things, etc. While people having a depressive episode may have trouble falling asleep or sleeping too much, experience increased appetite, having nothing to say, forget about simple things, and other things like that. Alright, so some risk factors. In the case of bipolar disorder, psychiatrists and mental health professionals believe that brain structure and functioning may be the cause of the disorder because individuals with the disease react to everyday life compared to those who do not have the disorder. Psychiatrists also believe that genetics may also play a role within the disorder, saying that some genes may be more likely to develop disorder. Diagnosis. Mental health care providers, such as psychiatrists, are the ones who usually diagnose the disorder based on the individual's symptoms, lifetime history, life experiences, and family history sometimes as well. The individual must have had either a manic episode last longer than 1 week and also show at least 3 symptoms of bipolar disorder to be present, such as grandiosity, pompous superiority, or being very pretentious, excessive talking or pressured speech, and engaging in activities with a high potential for painful consequences. Alright, so treatments and therapies. Medications may help improve the quality of life for individuals, may include mood stabilizers and antipsychotics like risperidone, fluoxetine, and carbamazepine. Alright, so psychotherapy, more commonly known as talk therapy, aims to help a person identify and change troubling emotions that may trigger manic or depressive episodes for the person within their life to help try to fight having any more symptoms from bipolar. So some other options may be brain stimulation such as electroconvulsive therapy, ECT, and transcranial magnetic stimulation are now being used by researchers to help give a patient relief from severe symptoms caused by a disorder. Other things such as exercise or keeping a life chart may help to prevent symptoms from bipolar disorder, since it is keeping the brain focused on certain tasks in everyday life rather than being stuck in their own head. All right, complementary therapies. Meditation is recommended due to its factors to be able to have a reduction in depression depending on how often the individual meditates. And then there's also light therapy. Light therapy can help people with bipolar disorders get back into a regulated sleeping schedule by being in periods of light and dark throughout the day. So during light, they're more alive and awake doing everyday activities, and then during the dark periods, they're also going to be able to get tired and go to sleep. All right, on the resources page, I've listed a few local resources in Lynchburg, Virginia that can help you with bipolar disorder and trying to be able to treat it to make it easier for someone to deal with the disorder. So we have LifeBridge Counseling and then Centra Health. And I have both numbers listed for these resources. All right, and this is my work sets page. I hope everyone enjoyed the presentation, and I hope everyone's presentations go very well. Thank you, guys.